Are you tired a lot, dizzy? Do you have shortness of breath? These are just a few of the symptoms that might mean you have arrhythmia. Here to tell us more is Dr. Subodh Deyabaktuni, a cardiologist and electrophysiologist who specializes in heart rhythm problems at UAMS, the University of Arkansas for Medical Sciences. This is UAMS Health Talk from the University of Arkansas for Medical Sciences. I'm Aileen Ellis. Doctor, what exactly is happening to the heart when you have arrhythmia?
The normal heart rhythm is called the sinus rhythm. It's a rhythm produced by the natural pacemaker cells inside the heart. So when rhythm is other than this sinus rhythm, we call it as arrhythmia. Some people have symptoms like heart beating fast. They say it as palpitations or heart racing, or some describe it as fluttering in the chest. Some people get short of breath, chest pain, and some complain of fatigue. So what's happening is these heart rhythm problems can be either regular or irregular. The heart arrhythmias. There are different kinds of heart arrhythmias. Common thing we see is the irregular heart rhythm, which is called atrial fibrillation. That is the most common irregular heart rhythm we see. This is often in elderly, more than like 60, 65 years of age.
And does that mean that your heart is skipping a beat every once in a while, or what?
Right. The skipping a beat, it depends on what you take it. There are a couple of arrhythmias where there are extra beats coming from. Normally, the heart beats regularly, but sometimes a beat comes in early. This beat can be coming from the top chambers in the heart or coming from the bottom chambers in the heart. So typically, we describe this as skip beats. They come in early. We call this as premature atrial contractions or PACs or premature ventricular contractions, which are coming from the bottom chambers, which is called PVCs. This is typically what we describe as skip beats.
And what are some of the things that can cause this condition besides age?
Yeah, the PACs and PVCs, it can happen to all of us. If we do a monitor on you or me or someone else, we have PACs and PVCs occasionally. That's quite normal. But if we are having a lot of them, then that is not normal. That's when people are symptomatic and we need to treat them.
And when do you need to talk to your doctor once you experience some of this?
So any patient who is experiencing skip beats or palpitations or fluttering in the chest, I would ask them to get medical advice. And then what we typically do is if patients are complaining of those, we put them on a monitor. These monitors are of different types, from 24 hours to 48 hours to a week, couple of weeks, and to a month. So we do put them on these monitors, and then they can press a button on this monitor whenever they have symptoms, and it will record the heart rhythm at that point. Then we know that symptoms are because of this abnormal heart rhythm, and so that we can treat it appropriately after we diagnose what it is.
How is arrhythmia treated?
So arrhythmia is treated in different ways. Most commonly, what we initially use is the beta blockers. The medication we use to treat for hypertension, like metoprolol, carvedilol, and also there are some other medications like calcium channel blockers, like cardizem, verapamil. These are the initial choice of medications to treat these, like extra beats. But if the symptoms are more frequent, not controlled with these medications, there are certain medications which are we call them as anti-arrhythmic medications. That means these medications help to keep the rhythm in normal, which is the sinus rhythm. So these medications are usually prescribed by cardiologists and especially cardiac specialists who are trained in treating these heart rhythm problems. Because these antiarrhythmics, we can't use them in every patient. We have to be very careful. Although they are used to treat heart arrhythmias, they can cause heart arrhythmias by themselves if you are not careful.
And what can one do and not do once you're diagnosed with this condition?
Most of the times, we advise them to do whatever they can, like exercise, eating healthy diet. Some people, these arrhythmias are triggered by like excess of caffeine intake, excess of alcohol. They clearly attribute the symptoms to these. So in those patients, we advise them if it is clearly getting the symptoms from caffeine or alcohol, we ask them to avoid them or at least drink it to moderation in every day.
And can it be that you would, with diet and exercise, be able to control it without medication?
Typically not, but again, exercise and healthy diet always plays a role in bigger picture, making heart healthy. That's what we're aiming for, but not specifically to treat this, especially the heart arrhythmia problem. We're talking about the atrial fibrillation, which is the irregular heart rhythm, where the top chambers quiver. In those patients, exercise and weight loss and have shown to improve their symptoms in AFib. Especially in that problem, we treat with medications, and if not controlled, there are procedures called ablation, where we treat these heart arrhythmias. The common ablation we do is for AFib. It's not a cure for AFib, but we can help the patients who are symptomatic from atrial fibrillation with this procedure called ablation.
And finally, can arrhythmia then lead you into a heart attack?
Usually, typically not. Most of the heart arrhythmias, heart attack is totally different. Arrhythmias is different. I say it as arrhythmias is a part of electrical system in the heart, and heart attack is part of plumbing. So it's like the blood vessels would supply the heart. They're like pipes. If there is a blockage in there, then you get heart attack. If you get heart attack, you can get arrhythmias. But if you have arrhythmias, it's very, very unusual unless you have a blockage to have a heart attack. These arrhythmias by itself cause symptoms like palpitations, fluttering in the chest, or chest pain, typically not a heart attack.
And what are the symptoms that one should really rush to a doctor or an emergency room for?
In terms of especially chest pain, I would say tightness in the chest or heaviness in the chest, and then palpitations. Some people have symptoms like dizziness or they pass out from these arrhythmias, then I would suggest to seek medical attention. The main thing is, and you check your pulse, and if it runs in like 160s, 180s, then definitely you should seek medical attention immediately.
Is there anything else you'd like to add, doctor?
These heart rhythm problems, most of them are not life-threatening, except few of them where you have cardiac arrest from these heart rhythm problems coming from the bottom chambers. Most of the times, heart rhythm problems coming from the top chambers, they are not life-threatening. And especially in patients with AFib, like the irregular heart rhythm, we see every day. These patients, depending on the risk factors they have, like hypertension, diabetes, stroke, the AFib can cause stroke. So we typically give blood thinners in these patients. We do a scoring system. If you have 2 or more points, then we put them on blood thinners to prevent the strokes, because these strokes can be devastating to the patients. They could be massive strokes. Some people die from these strokes. So we typically give blood thinners, not aspirin or that kind of blood thinner, but a stronger blood thinner to prevent the strokes in these patients. Sometimes, unfortunately, these AFib patients cannot feel any symptoms. It just gets recognized whenever they come to the clinic. In a primary physician's care clinic, they check the heart, it's beating irregular, they do EKG, then they figure out the patient is in AFib. So as soon as we diagnose patient with AFib, it's very important to make sure whether they are getting they need a blood thinner or not, and they should seek a cardiologist's advice at that time.
And one final question. I'm assuming that as you get older, the percentage of people who get this goes up. So would you recommend that you have your heart checked at some certain point when you age?
Yeah, this should be part of a regular primary care wellness clinic wellness visits. They check your heart, they check your heart blood pressure, heart rate. So, and on physical exam, if you find the heart is beating irregularly, that should be addressed with an EKG and then refer to a cardiologist if needed.
Thanks so much, Doctor, for your time and insight today. Dr. Subodhaya Bhakhtuni is a cardiologist and electrophysiologist who specializes in heart rhythm problems at UAMS, the University of Arkansas for Medical Sciences. For more information on arrhythmia, visit uamshealth.com. If you found this podcast helpful, please share it on your social channels and check out the full podcast library for additional topics that may interest you. This is UAMS Health Talk from the University of Arkansas for Medical Sciences. I'm Aileen Ellis. Thanks for listening.